Have you had your yearly diabetic foot check? There are a multitude of reasons why diabetes can affect your feet, and that's why it's very important to actually have them checked by a professional at least once a year. Now, if you need more specific information and details about the things that I'm discussing on the video, make sure to visit our website after the video is complete. So let's get into how does diabetes affect the feet. The first thing I want to talk about is something called peripheral neuropathy, which is a disease that happens in the nerves of the legs. Now, you don't have to be diabetic to have peripheral neuropathy, but it's something that is actually very common within the diabetic population. It is a burning, tingling sensation that you experience in the nerves that sometimes can lead to complete numbness, which can obviously be very concerning if you can't feel your feet. A second thing that can happen with diabetes is poor blood flow. So diabetes causes an increase in cardiovascular disease, and that also includes an increased risk of something called peripheral vascular disease, or disease of the blood vessels that are in your legs and feet, which can decrease the amount of nutrients that your body is getting and can make it harder to heal things if you have an injury. Thirdly, diabetes also causes a reaction in your sweat glands that decreases your ability to control moisture in your skin. So you end up with dry skin. It's not uncommon that you'll see really rough, dry skin, dry heels, or even excessive callus formation on the feet. Lastly, diabetes weakens your immune system. So it's just in general harder for you to prevent infections or injury. So you add all of those things up together, it kind of puts your feet at quite a bit of risk if you have all of those risk factors. You can easily have an injury that can progress to an ulcer or a sore that takes a very long time to heal, that's very prone to getting infected. And that's why we hear about these very scary things like amputation that can happen in the diabetic population. So for this reason, the American Diabetic Association actually recommends, if you are diabetic, to see a podiatrist once a year for a yearly foot exam. So what exactly is a yearly foot exam? It's very quite simple. Oftentimes it starts with x-rays just so we can get a baseline structure of your foot and identify any risk factors in just your foot structure, your bone structure, any underlying arthritis or things that we see there that could cause problems down the road. We also do a very basic and simple physical exam on the feet, testing the nerves, testing the blood vessels. Occasionally, depending on what we find, we'll order some advanced testing to further investigate these things, but it's still very all non-invasive. Based on your history and what we find in exam, we can then give you a risk score, and that helps us determine how often you have to see us. If you're low risk, you just check in once a year and we repeat the exam to make sure that you're okay. If you're high risk, we see you more routinely so we can make sure we're preventing things from happening and keeping you safe. Everything that we do in our office at Third Coast Foot and Ankle always gets shared to your primary care doctor or your endocrinologist, so we can incorporate that diabetic care as a whole picture, because unfortunately diabetes does affect your whole body, not just one organ. So it takes a team to really treat you. So if you have diabetes and you've never had your feet checked by a professional, I highly recommend you reach out to your local podiatrist and schedule an appointment. If you are in our area, we'd be happy to help you. You can visit our website, and our staff is always ecstatic to help prevent things from happening for our patients.